It's Reefer Madness, the podcast, with Trevor and Kirk.
Hey, Reefer Madness podcast listeners. Thank you for coming to YouTube and watching this podcast. Trevor and I did our raps, and he was a Winnipegosis, so you're going to find some technical difficulties with his internet bandwidth. So he cuts in and out and stalls. Just know that as you're going into it. Enjoy. Yep.
All right. So, Kirk, we're back. So it is, as you can see by the poppy on my lapel, November-ish when we're doing this recording anyway. And we talked to one Manitoban and one gentleman from Ontario, so I guess an all-Canadian four-voice thing. What did you think of, and this is our second time with Apothecare, so a few things. One, and not everyone needs a trauma story, but that Sean has been involved in the cannabis industry for a long time and has been, done legal cannabis through like Canopy. He owns his own distribution company and two stores in Manitoba, one in Winnipeg and one in Ste Anne, which we'll talk about. But he also had heavily interested in sort of as a recreational guy, we'll call it that, but has lots of roots in the helping people out. Cannabis may or may not have been involved in him helping deal with the trauma of his brother passing away at age 11. He now has elderly parents who have medical issues. So bringing medical cannabis stuff, clinical cannabis, helping people cannabis into what would be traditional rec store seemed to be a natural fit for him. And Ajay, another really interesting guy, pharmacist, I thought it was cool that he sort of kind of stumbled across cannabis education during his training and found out basically pharmacists have none of it, and started working on trying to do cannabis education, and eventually just went, well, why don't I just talk to patients directly? As I've got this education, your standard pharmacist doesn't. Why don't I educate people directly right in the rec stores where they are now?
Yeah. It was episode 149. We first met Apothecare, and that they're an Ontario pharmaceutical company that are picking up with rec stores. So in episode 147, or the video number 7, Stoked for Apothecare, we discussed how they are joining partnerships with rec shops to meet a market need. I've often said that healthcare seems to be ignoring cannabis. Right now, the Canadian Medical Association have pretty much told their members that cannabis is not medicine, although many doctors are prescribing cannabis. The nursing profession seems to be one of the very few professions that actually have policies for their membership. So the College of Registered Nurses of Manitoba actually have policies of how to use cannabis as medicine. And whereas my search and someplace in the interview, I think I mentioned it, or maybe it didn't make it, but I did a quick search of colleges in Manitoba, professional colleges in Manitoba. That's the pharmaceutical college, that is the nursing colleges, that is respiratory therapist colleges, physiotherapists. Any of them that have policies view cannabis as a substance of misuse, and many of the policies were developed in 2017, 18, 19, when rec cannabis became legal. So what I like about this conversation is that there seems to be this pharmaceutical business in Ontario that recognizes cannabis is being used as medicine and bought from rec shops. So this is what this episode is about. When we come out of it, I want to talk a little bit about the ethics of this and the politics of it, because although I appreciate what they're doing, I just feel a rant coming on about how cannabis is being ignored right now by healthcare. And I congratulate these guys for doing this. I'm being pushed and pulled on this episode, Trevor. But I think maybe we should go on and talk to these guys and see what they have to say, and then come out and discuss what they said to us. What do you think?
Sounds good. Let's listen to Sean and Ajay. I've got a bunch of people on the screen today. We have Sean from Supercraft, Ajay from Apothecare, and everyone knows Kirk. Today we are going to, and it'll make sense in a bit, but we'll get them to introduce themselves along the way. We're going to start with Sean at Supercraft. We'll get him to sort of say his name and title, and then we're going to ask him a little bit about cannabis in St. Anne's, and then Ajay will make sense as we go along. So we're going to start with Sean at Supercraft.
Sweet. Hello, everyone. Thanks, Trevor and Kirk, for having us on here. My name is Sean Stewart. I'm the founder of Supercraft Cannabis, which has 2 licensed retail locations in Manitoba. I'm also the president of 100 Pounds, which is a licensed retail distribution. What can I say? I mean, I've been involved personally in cannabis for over 30 years as a daily user. It's helped me through a lot. And, I really believe in the application as a medicine for certain people, not everyone, but certain people. And yeah, I mean, we came here. Actually, I'm from Toronto. I worked in the legal side of cannabis. I actually started working for Canopy Growth prior to legalization. So I've been involved, pre-legalization up until now, which would be, I think, considering like a somewhat of a veteran in the legal side, at least. And then, as I said, 30 years before. But we launched Supercraft Ste Anne about 4.5 years ago. We moved from Toronto during the height of, or the beginning of COVID, to a little town in Manitoba called Steinbach. And the entrepreneur in me noticed the opportunity that there was really no licensed cannabis stores outside of Winnipeg to the southeast. And so, yeah, started working on it. Took about 9 months from start to finish. And then we launched in June of 2021. In terms of Supercraft, our focus has always been craft. One of the things that I've been involved in heavily from the very beginning is I've always just been into super high-end cannabis. It's kind of the groups that I hung out with when I was younger, up until university, etc. That's the one thing that we were always into. So it was interesting because, and not to go on forever about this, but back to St. Anne, what was interesting is that the business model in terms of, carrying craft only products or family owned business type products, and really focusing on the ethical side, as well as the high end side. It just worked. And there were a lot of doubters, honestly, particularly in that area, because it's very deeply rooted in the black market, or legacy, whatever you want to say. But yeah, it's worked. And I think one of the main reasons for our success in that location are exactly what we're going to talk about today. So like the senior citizen population. And so that's kind of me in a nutshell.
Sean, sorry, Trevor. I like to get a little deeper.
Kirk.
I like to get a little deeper. I'm a little bit of a nurse, right? So backstory, university, what's your university major and how did you get into the legal profession in the very beginning? Like where's your passion? I mean, yeah, recreational user, but are you business major? What's your university?
Yeah, I've got a kind of an interesting past, I would say. My degree, I went to McMaster. My degree is in economics and math. I'm an artist so not to say that my degree was the foundation for why I'm doing what I'm doing now. That's just, I think it's innate. Like I'm an entrepreneur. But the one thing that I will mention in terms of the very beginning, you know, when I was 11, my brother passed away. And as, you know, all kids kind of, or all adolescents within that age, uh, you know, it could go any which way. And for me, it started in cannabis. In fact, it started a little more broadly than that, but it was one of the things for me that has kept me, you know, calm, cool, collected for the last 30 years, I would say. And to answer the first question about getting into the legal side, I don't know. It was weird. It was, for me, I had a couple of different opportunities, and I was actually, before I got into that, I worked for Holt Renfrew, so I was kind of like on the fashion side for a while, and just never thought. I mean, again, going back to like smoking weed for, at that point, you know, almost 20 years, I never kind of put it together. And then when, you know, legalization was coming up and I had some friends of mine that got into it, they're like, hey, dude, like you should take a look. And honestly, at that point, I was like, I don't know. I don't know if I could work for a legal company. And yeah, fast forward, whatever, almost 10 years now. Here I am.
Thank you, Sean. Now that actually segues nicely. So for those who don't know, we may talk about it a little more later. St. Anne's is a traditionally very French community in Manitoba, and like a lot of little communities, like the one Kirk and I live in, a lot of seniors. So seniors have a large interest in cannabis, and I think that goes nicely to Ajay. You're a pharmacist, and we have talked to your co-founder Anusha before about what you guys are doing, your company's doing with rec stores. But how about just a quick recap, who you are, what your company is, and what you do, and then sort of we'll go into how you and Sean got linked up together.
Yeah, absolutely. So my name's Ajay, pharmacist, graduated from U of T, co-founder of Apothecare, which is a pharmacist-led cannabis consultation company, with the inspiration behind it being that healthcare professionals are not educated in any real way about cannabis. And given that patients were looking for information about cannabis, its therapeutic benefits, and there was a massive gap in care. That was the inspiration for founding Apothecare to address this gap. And what we noticed was that patients were going into retail stores. I don't even call them rec stores anymore because there's a massive breadth of products there. So they're going into retail stores, asking about cannabis, what it can be used for, like insomnia, pain, anxiety, and they can't get essentially the medical expertise to ensure that it's safe, appropriate, getting dosing, medication interactions. And that's where we founded Apothecare. We made sure to educate ourselves with the clinical literature and worked with Budtenders to try to accumulate as much information about cannabis and provide consultation services for any Canadian virtually across Canada. So we partner with different retailers who are wellness oriented to address that gap. So if a retailer is getting a customer or patient coming in asking all sorts of questions like, oh, can I take this with my medications? What can I use for the pain? I'm dealing with cancer and I want something for the insomnia that I'm experiencing with chemo. What can I do? They have the retailers now have a service where they can um, uh, refer to Apothecare. We can do an in-depth consultation, make sure that cannabis is safe, appropriate. We don't diagnose. It's really focusing on doing a very careful history of what their current conditions are, what their medications are, see what products are available and what makes sense, what dosing makes sense, and then sending them back to a retailer to then purchase that product and ensuring that the products that they're buying are from retailers that are licensed, because we've had a lot of consultations where patients come to us and they thought that the black market store that they were purchasing cannabis from was a legit store. So there's a lot of education around that as well.
Okay, and after this we'll go into more interesting detail, but let's pretend I'm a patient. So I'm a 50-something-year-old pharmacist. Well, I'm a 50-something-year-old accountant, and I walk into your store, Sean, and I play fat old man hockey and my knees hurt, and one of my buddies said that something in your store might help me. How does that start, and how might you refer me off to Ajay and Apothecare?
Yeah. So, and I wanted to just go back to what Ajay said, and emphasize this, is that even within the agreement that we have with the MBLL and other licensing authorities, we are not, like, it's blatantly in bold letters, we are not to provide medical advice.
Right.
And so a lot of people don't know that. I mean, everyone that comes in seeking medical advice, they obviously don't know that. So in your situation, what we normally do is there's a couple things we can do. We can provide general guidance based on one would be like anecdotal kind of analogies, or the other would be, just narrowing down options based on symptoms. For example, sleep, CBN, right? And those two things. So that obviously takes an educated person to be able to guide them to those specific areas, let's say. For me personally, if I were in that situation, I would, I guess it really just depends on what the symptom is again. But I normally go to an anecdotal story about my mom or my dad, or, just like past experiences. We can somewhat travel into that realm, because it's teetering that fine line between medical advice and just like talking about my mom. And where we would normally provide a connection with Apothecare, there's a bunch of, sorry, my dog.
No worries.
There are a lot of different reasons why we would. One example comes to mind that literally just happened yesterday. And that was friends of ours have a son that was just recently diagnosed with cancer. So these are conversations that for me, that is not even a conversation that happens in the store. That's kind of like a direct connection to a medical professional. So there are some situations where, it's clear that it's not just like, try this, take it home and see if it works. It's more or less, how should this be administered to this particular patient? My dad is another example. He's in palliative care right now with dementia, and he added CBD to his medicinal regimen. And that was, again, that was a consultation with a nurse. But kind of where we draw the line in the sand again are those anecdotal stories. And if we feel like, that conversation is warranted beyond that, or if the customer could see some benefit in connecting with Apothecare, then we make that connection at that time.
John, your client demographic, you've got two stores. Do you find that there's a difference in demographics to community? And who do you see more of? Do you see young people? Are you seeing older people? What are you seeing in your store?
Oh, totally. And I would say, or I would argue that there are vast differences in the demographic. Well, yeah, between the two stores, one being in Winnipeg in Bridgewater and the other being in Ste Anne, there are vast differences. I would also say that there are probably vast differences within different parts of the city or even different rural areas.
But with your store specifically,
Mhm.
you see more seniors in the small environment or more seniors in the urban environment?
Definitely more seniors in the rural areas. Yeah, it's there, and don't get me wrong, there still are young consumers that we have. I mean, it's probably like a 50-50 split all over the place. But what is surprising are for St. Anne, but what is surprising are the sheer amount of 60 plus that do come into the store.
And do they have more questions than the young users? Like, do they come in with more? I know you can't prescribe, but do they come with more medicinal type questions than the young person?
Absolutely, yes. However, on average, likely, but everyone from a 20-year-old up into an 80-year-old, they kind of all have the same types of issues if they're going down that medical route.
Okay.
Right?
Thank you.
Sleep, pain, anxiety.
Yeah.
It's kind of.
Yeah,
So,
and
Ajay,
go ahead.
no, I'm just going to add in whatever you want, but let's say, so I visited Sean. I'm a 50-something-year-old accountant, but I happen to let slip to Sean that, but I'm also, I've got prostate cancer, but it's well controlled, and some diabetes, and red lights go off in Sean's eyes. He says, "Yeah, I think you should talk to Ajay." So if I have now talked, how would I get a hold of you? What happens next?
Yeah, so there's two different ways. We wanted to make it as accessible as possible. So we have our toll-free phone number, which you can call direct and get information about our services. And then we can book an intake where we go through your full medical history initially to make sure that we have all that information. And then we do a consultation. So where myself or Anusha are reviewing the intakes in terms of the medications you're on, your medical conditions, your social history, things like, is there a close family history of, say, like addiction, psychosis, anything that would be important for us to make recommendations. And then when we book a consultation, that's when we go through the actual information and go through the process of different products and what makes sense. This is all done virtually, so it's done on clinic software. So we either do it via video call or by phone, whatever is preferred by our patients. Or you can, and if you don't want to give us a call to book an appointment, you can book online. So at www.apothecare.ca, you can book direct online and schedule a consultation where we'll do the intake and then the consultation afterwards.
Ajay, are you using
Go ahead.
standardized tools? Are you using standardized tools? Like, are you using tools other practitioners might use, or these questionnaires that you guys have come up with?
So if let's say there's a flag of something where we've created the intake personalized for ourselves, but let's say if someone has like an addiction background, then we will do like a cut at R. So that's like a standardized tool to assess that in greater detail, so that we can have a more educated, precise look. Because we're not doing diagnosing, we're not going to do like the certain scales when it comes to like depression, things like that.
Okay.
We're doing more of a history, and then it's more of, think of it like a very in-depth OTC consultation, like an over-the-counter consultation.
Okay.
And
Sorry,
without
Trevor,
going too far, no, that's okay. That was actually on my list. And without going too far down the pharmacy weeds, I'll try not to bore everybody, but drug interactions, that's a big thing, a part of what both of us do just in our day-to-day, but not so easy necessarily with cannabis. It's a little harder to sort of plug that into a standard drug interaction algorithm that I've got in my pocket right now. So I'm on 15 meds. How are you figuring out what might be a problem and what might not?
Going right down to the first principles. So we're looking at how each medication is metabolized, looking at therapeutic window. So for example, like if someone's on atorvastatin, 10 milligrams, which is a cholesterol medication, large dose range, and you're at 10 milligrams, which is a beginning dose. CBD can interact through an enzyme metabolism, CYP3A4. I don't want to get too complicated, which could increase the amount of that medication in your system. But given the dose range goes from 10 to 80 milligrams, we're not as concerned. But if someone's on, say, warfarin, which is a blood thinner with a very narrow therapeutic index, so if your amount of that changes in your blood, that could have significant bleed risks. So we have to go through each and individual medication, assess kind of what is the narrow the therapeutic window, we'll say, in terms of its safety, and make a clinical judgment on each and every single medication. Fortunately, there's no clinical tool that we can just plug it in and it'll tell you, oh, this is exactly what you should dose at. It has to be a very careful clinical thought process in terms of looking at dosing, what's safe and appropriate, and then monitoring too.
Okay. And so you've decided, my fictitious accountant with sore knees and some prostate cancer and diabetes, so you've decided it's all, nothing seems, the interactions seem fine. And the two of us have decided together that, yes, I'll make something up. Some CBD oil might be an appropriate thing for me. How do we complete the loop? How do you send me back to Supercraft, or what happens next?
Yeah, so a couple things. I write up my note formally, give access to the patient, get consent to see for them to allow me to also send that note to their family doctor to keep everyone in the loop. I then will call Sean at Supercraft, say, just talk to, after getting consent from the patient, but I call Sean at Supercraft, say, talk to the patient. This is the product that I recommended. This is his name and phone number. You can give him a call, let him know that you have the product ready. I've also told the patient that who was referred out by Sean that the product will be available at Supercraft. They'll give you a call so that to confirm that they have it in stock and that it's prepped and ready for you for pickup.
And then I guess you must be in pretty close contact with Sean, because something I've run into, so I deal slightly, the little bit I deal with actual cannabis patients are even older, they're in care homes, and we're getting sort of stuff mailed into them. And something we've been running into is, we had one particular 20-to-1 THC CBD thing that was working well for a lot of people, then suddenly wasn't available, which, now we've got to drop a whole bunch of new dosing regimes for the nurses. I didn't want, the point is, it took a little while to get, to talk to the nurse, to talk to the place it was getting mailed from, and it was a little annoying for everybody involved because there had to be so many people involved. Do you sort of have a catalog or something of Sean's so you know what he's got, or do you give him a call ahead of time, or how does that get coordinated?
Yeah, so the retailers that we work with, every time that we do a consultation, because we know that products will change, formula or what's in stock with different retailers will change over time depending on availability, new products coming out. So prior to each consultation, I go check the website, see what's available, so that I'm not recommending a product that might not exist or might not be available, making sure that there's a good product for that particular condition prior to doing the consultation. So I take a look at the intake, I get a sense of, okay, which different type of products might be beneficial. And then after I've done the consultation, then we solidify on one, and then I make sure that it's available. If it's not, then I look at alternatives, talk with Sean, see what selection he has. If there's any gaps, we'll talk about, okay, what product might need to be brought in, and then go from there. Make sure that our patient is supported.
And Sean, just to finish the loop on our little fictitious person, how's this been going? Have customers been liking this, using this? Has it been working okay?
Yeah, I think it's been going great so far. As with anything, like the adoption is over time, it takes a bit for staff to get comfortable having those conversations. But what I will say, and just going back to Ajay's point, in terms of from our perspective in getting involved in a program like this, I think we've always kind of prioritized it, but I think any retailer that is getting involved with Apothecare is now prioritizing ensuring that we have specific types of products in our store. And so that's when it goes back to the question of, things change. It is frustrating from a retailer's perspective, but it is, at the end of the day, it's just business for certain things. So, we do our best to try to cover all of the bases in terms of what's out there and available with, minor cannabinoids, CBD, THC, non-THC, etc.
And last, before I let Kirk loose, because I know he's also got a million questions. So, Sean, you're a business person. You obviously make money when people buy the product. Ajay, how do you get paid in all of this? Who pays you, and how does that work?
Yeah, so the patient, it's unfortunately it's a non-OHIP, or I guess I'm not sure what it's a non-provincially covered service.
Yeah.
So it's a $75 charge for the full comprehensive consultation on Apothecare's end to do the assessment.
I'll jump
Okay.
in there too, because I think in some cases, for the example I said yesterday, a lot of the times as the store, we're just willing to chip in that $75 because we've built a relationship with that customer. And for us, it's just a little something extra that we feel like we can do for the community.
Oh, that's very nice. Now, put my pharmacist hat back on. Yeah, because pharmacists are terrible getting paid for our services in general. So I like what Ajay, whoever ends up paying, I kind of like that Ajay is telling people, look, the pharmacist services is worth $75. Now, whether it gets paid for by the store, by the insurance, by the patient, just, pharmacists, I'll try not to get off my soapbox. Pharmacists were terrible about getting paid for the extra services we do, but I'm going to stop because no one else cares about that but me. Ajay, legalities. You are based out of Ontario, you and Anusha. You are doing this across Canada. What do you know about, so as far as you know, a virtual consult is, like someone from Manitoba virtually ending up in your consult office in Ontario, so that works, or do you have to do different things for different provinces, or what do you know about that?
So because our service, our location, everything is based out of Ontario, and business address, everything that we do. So it's looked like as if someone calling from Vancouver to a pharmacy, if I was working in the pharmacy that day, asking questions about products, pharmacist is able to practice just like they were in Ontario talking to a patient in Vancouver. So that's how it's treated. And we do everything through our EMR system. So everything's documented, HIPAA compliant, to ensure that we're meeting those requirements.
Cool. Kirk, I'm sure you got questions before I keep going.
Yeah, no, I really appreciate the service you guys are providing, but I do have some medical legal issues I want to discuss. And one of the things I want to say is the services, the Public Health Agency of Health Promotions, Chronic Disease Prevention in Canada just put out a study about the perceptions of cannabis among adults 60 years and older. And you guys are definitely meeting the needs and the results of this study. But what I'm finding interesting is you are an online store, right? AAA Cannabis is an online store under under Supercraft, right?
Correct. Yep.
So you're a rec store, but you can buy online. So are you also a medicinal cannabis store? Because because
I would, yeah, go ahead. Sorry, continue.
no, I guess what I'm asking here is that Canada has two systems, right? It has the medical system, which is online purchase. You get your prescription from a doc or a prescriber, and you go online and you get your medical cannabis. We also have the rec cannabis, which is the brick and mortar. Now we all know that everyone are using brick and mortar now because it's easier, it's more convenient. You guys have sort of found a loophole around the medical cannabis system because you're offering people cannabis for medicine because they're coming to you for help, right? I mean, I'm being careful with my language because I believe everyone that uses cannabis uses it ultimately as a medicine. And Sean, you mentioned that with your discovery individually, and I led you into that because you discovered cannabis and you found that it helped you cope as an adolescent, and now you're helping people. But have we not circumvented the medical system here in a good way?
Yes. Yes, I will say that, and I don't know if it's necessarily circumventing, maybe it's more of an evolution. We've seen this happen over and over again in the US in terms of the starting with medical and then turning into recreational, and then more or less the abolishment of the medical side of things. I think that's just a natural progression. I feel like there are a number of reasons why people don't necessarily go through medical. One is obviously convenience. The medical system in Canada is, well, there's a few different avenues, but in terms of buying finished products like oil, it's only mail order. So, versus driving to 15 minutes down the street and grabbing what you need right away. That's one strike against it, I feel. And in my mom's experience, quite honestly, like she's found that the medical, and we could go really deep into why this is a thing, but the medical products are actually more expensive than the recreational products, apples to apples. And
it's the whole tax issue. We've done episodes on that. Understood. Yeah.
Right. So those two things alone is like convenience and price are, those are two of the biggest drivers for consumers. So that's why I would say it's definitely shifted or is shifting.
Yeah. And I have some comments to add too. And to reiterate the price comment is when I was doing a presentation at a cancer center, talking about some of the myths around cannabis, some general information. One of the patients there went through the medical access system. And she was telling me, she's not working right now. She's going through chemo, money's tight, and she's stuck having to pay, I think, close to $100 to get her CBD oil because that's the only way to get the shipping for free. And she told me about the product. I'm like, oh, the cannabis retailer down the street has the same product and you don't have to spend $100 at a time. And she was mind blown by the fact that she could access the same product for significantly cheaper, not having to bulk buy when finances were tight. So there's limitations within the medical access route. First, you need to find a physician that will prescribe it for you. So how many Canadians have doctors? There's a whole access issue there. And then Canada Post is on strike every few months, and I believe they're shipping it. So there's access even if you have everything. And then we've had some scenarios and different cannabis clinics that are prescribing medicinally. Some are fantastic. We've gotten great feedback from other patients. And then patients find that they are kind of left on their own to sort out and choose and figure out the product selection themselves, which they find incredibly intimidating. And they'll have their consult medically, and then they come to us after, and then we'll do a full consultation with them and help them select a specific product so they get the support that they need. Because when you're 70, 80, trying to figure that out by yourself, it's incredibly daunting.
So what do you find? What do you find the product you're dispensing? I'm going to use the word dispensing here. What product are you dispensing more? Flower, oils? Where do you seem to be putting an emphasis?
It's all 99% of our patients are like not are like more like first time users, or because they're 60-year-old plus would be the majority of our patients. They might have used cannabis like 30, 40 years ago in their youth, and now they're thinking about using again. They're like, this is completely new. So it's oils, capsules, it's not flower. We've had some patients who are already using flower, and then we'll discuss that, but it's really more so people are new to cannabis. They don't know kind of what to do, what to look at, and it's typically the oils and capsules.
And are you giving them a prescription in the sense, start low, go slow for 3 days, this much until you get the result? Are you actually giving them
Yeah.
a recipe to follow?
Yeah, absolutely. So we give them like clear guidelines. So I had a patient like that just earlier today. I did a consult, said initiate the dose because he was doing and I can't get too details because of
Yeah,
privacy,
yeah,
but he was combine he was at a retail store and combining a couple different oils together,
yeah,
massive CBD dose, like almost no THC, needs some and no CBN for sleep.
yeah,
So optimize that, took him off those, chose a product that made more sense. Said first day, first couple of days, start at this dose, then increase to this after a few days while monitoring your sleep because we're trying to find an effective dose before getting into the recreational
yeah.
doses. And then I'll be doing a follow-up in a week to see how he's doing.
Well, this service is neat. I was just sitting down with a friend of mine at a meeting, and she was asking me about cannabis stuff. So I sat down. What are you doing? Well, my daughter gave me CBD capsules that I take 3 times a day. How much? 300 milligrams. You're taking 300 milligrams 3 times a day. Yeah. Thinking you're taking way too much. But so my point being is that there are people, and this lady's also in her 60s. And the first thing I told her to say, find a prescriber, right? Talk to somebody. So you're providing that service when people walk into a rec store, they got that service. I think it's fantastic. It's an
And
interesting
Sh-
model.
and Sean, I just want to circle back to you because again, for those not from Manitoba, you're St. Anne's small town, traditionally French, older, uh, generally conservative. So that might not be the group that your average Canadian thinks is looking for info on cannabis, but the stigma's kind of coming down, isn't it? Like there are older, more conservative Catholic French people coming in there and asking you for questions about cannabis, aren't there?
Oh, for sure. And what I would say, and we kind of joke about it, is, it's, I feel like what was not, what was surprising in the beginning was the support from the community. And I feel like the French community was always very open to it. What's surprising is, and I'll just like quote unquote Bible Belt area, which is
Yeah.
Steinbach. That part is surprising because what we see more of are seen like conservative seniors coming into the shop and looking for these types of solutions. So yeah, I mean, if you don't know the dynamics between the two places, St. Anne and Steinbach has not allowed cannabis stores and probably say for the foreseeable future, maybe the next, call it 2 to 4 years.
And,
It's
and to
going to
give
take a
people
lot.
context, when I was a young person, we'd have hockey tournaments in Steinbach, and my parents would get hotel rooms outside of the city limits of Steinbach because Steinbach at that point didn't allow alcohol. Like Steinbach only allowed alcohol in the last 20 years. So yeah, it's been a very Mennonite, very conservative place for a very long time. So sorry, keep going.
Totally. No, yeah. And I mean, that just totally emphasized the point that I was trying to make was, in terms of the stigma changing, if a place like Steinbach, as conservative as it is, have, its elders come as they did to buy liquor outside of, in St. Anne to ask questions about this, then yeah, absolutely it is.
Oh, that's very cool. I'm loving everything about this story. Sorry, Ajay, we're getting close to the end of time, so I'll and jump in with either of you on anything, but we'll go with my usual. Is there anything I forgot to ask or anything you wish we'd asked about Apothecare and older people and Manitoba or anything along those lines that we should have talked about?
I think we covered everything. Just really the importance of anyone who's like medically complex on several medications. It's really important to make sure you're getting a healthcare professional that can really assess those interactions with cannabis, because even something like CBD, which on the surface many people think is completely benign, can interact significantly with medications. So it is really important for someone to scrutinize that and just make sure it's safe and appropriate.
I guess one question I have is, Ajay, where did you get your cannabis knowledge from? Like, does the College of Pharmacists in Ontario provide it for you? How did you get your knowledge?
Hundreds and hundreds of hours of reading through literature. So what actually sparked it, I became so I graduated in 2018 from the PharmD program at U of T, but in 2017, I was doing clinical rotations for the year as part of the regular pharmacy program. And one of the rotations was at a continuing education company called MD Briefcase. And they were one of the pioneers to do comprehensive cannabis um, education modules. And back then, before cannabis was legalized, I was very curious because I heard about the therapeutic benefits. And so I had done a lot of work with them during my rotation and was allowed to do their education modules, which was quite comprehensive. It was, they charged like $1,000 for it. It was like 10, 11 modules. You had to write a written exam, and then you got certified in cannabis therapeutics. And so I was very interested in cannabis, just because I was part of, helping them out and learning about the program. So when I was able to actually do it, I was probably one of the, at that time, maybe the most knowledgeable pharmacy student in the country in cannabis. Wrote the exam, got certified before I was even a licensed pharmacist, and just saw the potential and the massive gap in care. And that was maybe the first little step. And then there's so much more information needed, a massive amount of information within the retail market with the Budtenders, with like real world use that's just not captured. So discussing with that community was huge in terms of taking their academic clinical knowledge and pairing it with real world knowledge and trying to do a holistic approach of just like combining everything and being very transparent with patients. So I will tell them, CBG does not have a lot of clinical evidence around it, but we're seeing anecdotally that it's been beneficial for pain or mood that some patients have been finding in combination with their like a CBD or some THC. So, but it's always got to be that transparency when talking with patients. You can't say, yeah, this is great, this will work. It's about this is the clinical evidence. Let's try it. Everyone's unique and we'll find something right for you.
And the college in Ontario of pharmacists, are they encouraging this behavior?
So we
Like,
reached out.
are you seen as a maverick, or are you being told that it's a substance of misuse? Like, how is your college behaving with cannabis?
The college has essentially said, like, practice within your scope, and then they don't say, yeah, dude, like, there, as long as you're practicing with your clinical knowledge set with it and what is deemed appropriate, that's what they've said. Um, we've
So
seen
did
through
you
different.
get did you get some prescriber information when you took these cannabis courses? Because you are in some ways prescribing as well as helping them dispense. So did you in your certification courses, or did you get your
Yeah,
prescribers out of
well,
that?
that course was geared towards physicians. So yeah,
Okay,
it was through yeah. So although a pharmacist is able to take it, it was like MD briefcase. So it was that particular course was geared
okay,
towards physicians. So I got to learn really in depth how the medical access program worked in 2017. It's still the same,
right.
and I saw the gaps. And in reality, once I started practicing in 2018, patients were coming into the pharmacy asking about cannabis. And I was able to answer those questions, but I know I knew colleagues couldn't, and I
Yeah,
just saw this massive gap of okay, people are going to go straight into retail stores. They're accessible. They're not going through the medical access route. There needs to be healthcare professionals to address this gap in care, and that's where Apothecare was founded to really try to highlight education and
yeah.
service
You're
that gap.
building new pathways in a profession. It's fun to see.
Yeah,
And
it's
and
tiring.
and Sean, unfortunately, we got to start wrapping this up, but we'll give the last word to you. Anything else we should have mentioned, forgot to mention that you think the audience needs to know?
I don't think so. Just seconding what AJ was saying about just like really get a medical opinion for those more complicated cases. No, thanks very much for having me on. Pleasure. It's a pleasure working with Apothecare, and I'm hoping that we can roll it out to our other location.
So, Sean, Ajay, this was great. With Kirk, I think you guys are offering a fantastic service. Obviously, I don't know about seniors focus, but a lot of seniors will get a lot of this, and anybody who sort of takes advantage. Kirk and I talk often about how are people getting their information about how to use cannabis if they're going to a rec store, because, well, long story for other things is, there's even some physicians who just, go to the rec store and get something, which is terrible. But anyway, we won't go, but yeah, this is hopefully, like you said, closing that gap. If physicians and other prescribers are saying, go to the rec store and get your info, and the government is telling the rec stores, well, you can't give out medical information, it's nice there is a third option. So this has been great. Thanks a lot, guys. So Kirk, okay. Just like when we talked to Anusha in the last Apothecare episode, both Anusha and Ajay are pharmacists. So they are virtually seeing patients in their clinic on Ontario. So the way they see it and their understanding is it's like the patient virtually ended up in their clinic and saw them there. And so that works well for them. And I think it gives owners, store owners, rec store owners, retail store owners like Sean, a nice other option when people start asking them medical questions and they go, yeah, this sounds too medically complex or too much like a medical issue for a budtender to deal with. So I think it's a great combination. But I know that leads you into some bigger problems you have with the medical system and cannabis in general.
Oh yeah, Trevor, I'm all over this. I first of all, I congratulate these guys for doing this. But essentially what's happening is we got a pharmacist, and I respect you guys' skill. I've said this often that when I was in clinical practice up north, I'd often phone pharmacists, you being one of them, because you're readily available to me, to explain medication contradictions and stuff. So pharmacists are definitely important people within the healthcare system. But where in your practice have you been taught to prescribe cannabis? And I'm not asking this cynically, I'm asking this factually. So where, and I also know the curriculum of pharmacy has changed, that now a lot of pharmacists are coming out with doctorates. So give me some background on pharmacists and your training on prescribing.
Prescribing cannabis, we have none. There seems to be minimal at best.
Well, but prescribing any medication, though.
Well, we don't prescribe. And the Farm D isn't.
But you're allowed to recommend, are you not?
Kind of. So first, just you said pharmacists coming out with doctorates, not to split hairs, but they're different things. You can have a PhD in pharmacy, but that's kind of a research degree. And now most people who come out of pharmacy schools come out with something called a PharmD, a doctor of pharmacy. In my humble opinion, it's not really anything other than an extra year of training and money grab for the universities. I'm not sure. Back in my day, a PharmD was someone who sort of went back to school or stayed in school and specialized in something. Like PharmDs looked after dialysis programs. PharmDs looked after cancer programs. PharmDs looked after a cardiology ward. But now it's what's called an entry-level PharmD, meaning everybody who goes into pharmacy school and ends up working at Walmart as a PharmD. So in my humble opinion, that's kind of diluted down or watered down the whole point of having a PharmD. What can pharmacists do, quote unquote, prescribing wise? We never really prescribe, but depending on the province, like some of my colleagues can give you an antibiotic for if you're female and have a simple UTI. I can do an assessment on someone and give them medication that's normally prescription only for quitting smoking. So we have some limited, quote unquote, prescribing abilities, differing in different provinces. Like Alberta, it seems to be almost unlimited. Like they seem to be doing just shy of running a walk-in clinic. But yeah, we don't traditionally have a lot of training in like physical assessment or diagnosis or that kind of thing.
So from an ethical perspective then, And again, I don't want to besmirch these guys because they're providing a service, and I've quoted myself in the sense that the cannabis industry is filling holes in spaces healthcare is not filling. And I've said this often. For example, the whole concept of cannabis coaches. We have a non-regulated health profession developing, budding, growing, with the help of education, the help of other experts out there, because we healthcare providers are not filling that gap. So we need cannabis coaches out there. Here we have a group of pharmacists that have seen a gap and they're filling it. But there's some ethical issues here about pharmacists essentially prescribing cannabis, and they are. I mean, I asked them that in the interview. You're helping people, but you're prescribing a medication. Doesn't that piss you off that the prescribers out there, the nurse practitioners and the doctors, are ignoring cannabis as medicine? That pisses me off. And Ethan Russo, I just had a conversation with our friend Shelley Turner, Dr. Shelley Turner, yesterday, 2 days ago, yesterday. We were just talking about this. Ethan Russo has put out a statement, a consensus statement in JAMA Network Open about developing medical competencies in America and around the world. And essentially, they got together doing a Delphi, and we've talked about Delphi research before, and basically they have put out that it's about stinking time the health industry come up with core competency knowledge, and they've put out a statement. So the cannabis industry is upset with the health industry for not recognizing cannabis as medicine. And now we've got pharmacists in Ontario dipping into Manitoba, so they're crossing borders here, providing a service because we don't have the service. This is great, but it pisses me off. Does that make sense to you?
No, fair enough. I would like more doctors to be involved. I think what Ajay and Anusha would say is it's still in their zone of competence, zone of expertise, because the patient was going to buy and use this medication at the rec store anyway, and they're doing a comprehensive assessment basically to make sure the medication they were going to use anyway doesn't cause problems with A, their current medications, or B, the conditions they already have. So that's kind of what pharmacists are good at. Doctor, nurse, whoever, a prescriber gives a patient a medication, and the pharmacist helps assess, is that safe and effective with the other medications you're on and with the other conditions you have. So that's what I would think that Anusha and Ajay would say. Sorry if Anusha or Ajay, if you disagree, let us know. We'll put it in the comments. But that's my interpretation. But would I like more doctors to be involved? Absolutely. But to just again give Apothecare another plug, they do produce a document every time they do this and send it to the primary care physician when they've done sort of one of these assessments on a patient. So they're doing their best to sort of loop in the patient's healthcare team.
You know what? And that is a good comment to make, Trevor. I missed that. There is a collaborative nature of practice. I mean, in the recent years, most of the academic literature out there right now is talking about the importance of collaborative practices. It seems like everybody's practicing, but an old school doctor who believes that they control everything, which is really difficult to understand when you consider the education of many of the paramedical professionals. PharmDs now have this knowledge. There are nurse practitioners out there. There are physiotherapists now. I think entry-level physiotherapy is master's driven. So there are people out there with as much medical education in their narrow focus of practice as a MD has in the global practice. The assumption that's happening here, and again, I'm not besmirching Apothecare. I'm not calling them out. I'm just saying that there's a window of problem here, and that is is there true collaborative practice happening? I appreciate that pharmacists do medication reviews because you have the time, you have the expertise, you have the focus. You should be doing that. A family doc does not have that time to focus on everybody's med review. So they get a med review from a pharmacist. Fantastic. Now it's up to the doctor to then look at the lab results, the physical assessment, the objective information, the subjective information they gather from the client, and put all that together and say, "Ooh, we have a problem with this med." Now, you as the pharmacist might point out and say, this might be a consideration to consider with this med, but it's up to the doctor to go back and look at the big picture and see if he wants to make an adjustment to the med that you're talking about. And perfect example is blood thinners, right? Dr. Shelley Turner was telling me about how many of her clients are using cannabis with blood thinners. And she is having a real tough time trying to get her colleagues in the medical field to respect the fact that not only does she have the knowledge about cannabis, but they need to make an adjustment of meds because of the cannabis. So I think Apothecare has filled a gap. I respect that, I honor that, and I support them. But I'm calling out other professions that are ignoring cannabis as medicine and calling out Health Canada and not recognizing the importance of looking at cannabis as medicine as more and more aging people, my age, for crying out. I'm at retirement age working as a private practice nurse in cannabis. But essentially my peer group are now going to rec shops to get medicine, to get cannabis and use it as medicine. And we're ignoring that as a health profession. That bothers me. And over the last, year and a half, many of our episodes focus on this. How I've written about it in our blog, how people are using rec stores to get medicine. So Apothecare has recognized that, filled the gap. Congratulations. But it doesn't address the ethical question why prescribers, and you say doctors, I say nurse practitioners, I'm saying prescribers, why prescribers aren't paying more attention to this. It pisses me off, Trevor.
No, fair enough. But just sort of bring it back to Ajay and Sean, I think, Supercraft and Apothecare are filling a need, helping people out. People are doing better with them than without them. So I think it's a great service the two companies do and a great collaboration. I think we will wrap this one up. I'll say I'm Trevor Schufelt. I'm the pharmacist. He is Kirk Nyquist. He's the registered nurse. And where should they get more information, Kirk?
Yeah, they should go to reefermed.ca. We have a library of cannabis knowledge available to you. And I just dropped my earphone. I ask you to go to our webpage because there you can determine the episode, the topic you want to listen to. You can watch us on the video. You can hear us on audio by going to our webpage. Now, you can also hear us on iTunes and Spotify and all the other platforms that when you're on the move, you can listen to us. But by going to our webpage, you can decide better which episode to focus on because we have a library of information. And if you go into a library, you don't read every book every day. You go to a topic you're interested in. So that's what our webpage does for you. It gives you a topic. So yeah, go to the webpage, reefermed.ca. Tell your friends. I've often said Meta doesn't like us. We don't get pushed on social media. We depend on our listeners to share us. And to be honest with you, we are getting more and more listeners every month. And I think it's by word of mouth. So please tell somebody about us and help us get more listeners so we can get our editorials out there about cannabis as medicine.
All right, it's been another good one. We'll talk to everybody later.